Well, palliative care starts when a diagnosis of an incurable disease occurs. Starting at this point, all the care for effort is made to keep the person as normal as can be, without pain, without fear, without distress. It's not always easy, but it is possible. Therefore, the patients start palliative care at home. Most of them start palliative care at home. But with time, the person is not able to go to the hospital, is not able to commute, has to stay in his bed and starts to approach the end of life situation. Home is still the best place if the family is numerous, sufficiently numerous to be there all the time, day and night. If there is nurses and doctors who can be brought in and to look what to do and optimize cares. When this is possible, this is the best place. We have to realize that for some of our citizens, home is not the usual home. It's the hospice. It's the elderly places where they have to live now because they're alone. This is home for them. End-of-life care will have to be given there. And there's a lot of work to be done to make that possible everywhere. A third interesting place is the House of Palliative Care. In Quebec, Maison de Soins Palliatifs. Those organizations are there only for end-of-life care. You can go there, it's free, no pay. And you have a room, you have the doctors, you have the nurses, you have the volunteers, you have all this specialty that you need to be in comfort. This is probably the best possible place after home. And equivalent to that, it's the palliative care unit in a hospital. It's a special place in the hospital, very close to these houses. The last place to receive palliative care is the hospital. Hospital is there to cure you. It's a very busy place with operation room all the time, with examinations all the time, corridors with people walking, light open. It's not a place to die. It's not a place to live the last moments of one life. It's nevertheless where 50% of our citizens die. Why? Because they were at home and it became impossible. It's too difficult. They have to call the ambulance to bring in the hospital. They will take care and they will do their best, but it is not the ideal setting for living an end-of-life moment. We understand that in our society we have a work to do, an attention to pay to make possible the end of life at home, whatever home is.